come yesterday?
My name is David Stewart. I've been here now 5 weeks. I had some severe back pain and I had some surgery done on my arm at another facility before I came here. I have most of my life been self-employed and I provided for my own health care through that, but my company no longer exists and I currently have no health care other than what I've received since coming here.
My name is Janelle Getches, and I am a physician, and I'm medical director of Christ House, and I live here at Christ House. Christ House began because we would see so many homeless persons who would come to us with minor health problems, and then we would see them in the office and send them back out on the street, and we would watch these minor health problems become major ones. So we began to dream of having a place where persons who were homeless and who were sick could come and could be during the time of their recovery from their particular illness. Most of the people that come to us now, in the past, did not have any access into being able to have any health insurance of any kind. And so for years they often went without any health care except going to emergency rooms and going at the point of crisis.
A lot of physical ails that I have, I didn't even go to a hospital or doctor. I just tried to just work through it. But it eventually just got to a point where I'm 56 years old and my body just wouldn't take what it I just couldn't keep going any longer.
We save thousands of dollars of what would have been hospitalization days. And we have people who come out of emergency rooms or even inpatients for whom the hospital would have no place to discharge and would have had to have kept many, many more days if there wasn't a place, a respite care facility.
Is that comfortable?
Yeah, I don't know what caused this.
Well,
It's terrifying for one thing.
for some folks, when they're out on the streets, they don't have good access to showers and place to take care of their feet. And you're out in the rain and your shoes get soggy and they just stay soggy, and so you get something called trench foot.
I often say as a physician, what I see are complications of illnesses that just never should have occurred. That's why the death rate is so much higher, for those who have not had insurance as compared to those with those. And certainly among homeless, your average age of death among those who are homeless is in the 50s.
Spiritually and emotionally, I feel so much different than I did just a few weeks ago. And I'm just in a mode of trying to, I'm in, like I say, an attitude of gratitude. I'm just grateful and trying to stay in the program.
In the discussion of trying to reduce costs in regard to health care, certainly respite care units like this, I think more than they save thousands of dollars of health care dollars that would otherwise be spent. Giving everybody insurance access should help everyone to whether it will reach far enough where there'll be funding for respite units. I don't think that's a part of in any of the legislation at this point, so that's a hard one. It has not been anything that has been embraced through HRSA in terms of any significant funding for respite units, but I would hope eventually it would. When we dedicated Christ House, we stood out front here, and our prayer was that we could close it, that it wouldn't be needed. And I don't know that I'll ever see that day, unfortunately.